Hey everybody, and welcome back to the channel. Today we're going to be talking about lymphedema and the optimal management for this. So I didn't have enough room on my whiteboard, so I'm going to be going over notes on my computer, but this is just a general overview. I've had a lot of patients that have lymphedema plus neuropathy, and there's a reason for that, which I'm going to talk about in this video. But at the end, I'm going to go over some of the most effective treatments that I know that we've been having success with our patients when it comes to treating their lymphedema at home, and why these treatments are effective. And there will also be links to the research below. So it's not something I'm just pulling out of my butt. This is things that I am doing on a daily basis to help my patients who have these fluid retention issues, that have neuropathy, that have these metabolic compromises. So let's go ahead and dive into it. If you have any questions, please comment them below. I will give you my honest opinion, not saying that it is correct. It's just what I'm seeing from a clinical standpoint. So what is lymphedema? Lymphedema is when the lymph nodes and the lymph vessels in your body become clogged. This can happen due to various reasons. It can happen due to damage to the vessels, radiation, chemotherapy treatment. It can happen from diabetes. The elevated blood sugar will actually cause damage to the nodes in the vessels, just like it does with your nerves and blood vessels with neuropathy. So a lot of these are hand in hand. So signs that you're developing lymphedema are pretty obvious when you notice swelling in the ankles, the feet, the toes, the hands. Typically it's going to occur in the extremities. It's very rarely that it does occur in the trunk, but that can happen as well, and there's probably something more major going on. But swelling, fibrosis, which is just a thickening of the skin. So you'll see some people who have a thick, scaly skin on their feet or their hands, and that can lead to fibrotic compromise of these lymph vessels. And that's what will cause that swelling, that fluid retention, because the more pressure on those vessels, just like a water hose, if I squeeze it, it'll cause that fluid retention to build up and more internal pressure. You'll obviously have discomfort. Restless legs along with swelling can be a sign. I see restless legs as a very common sign when it comes to neuropathy, because people are trying to promote blood flow and lymph drainage in their lower extremities. And then limited flexibility. So I have a patient right now, and it's very hard for her to bend her foot. It's getting better, but if you have trouble, it can be because there's so much swelling internally that you don't have any joint space to move. There's too much fluid pushing back on those joints. So those are signs that you could have it. Obviously, these are worse in people who have congestive heart failure and kidney issues because of the fluid issues. They're unable to drain it as well. And you'll have a lot more toxins build up, especially with kidney issues. Different causes, so cancer can cause it. It's very common that we see this when our neuropathy patients that have chemotherapy or radiation therapy. You have to understand that those therapies, even though they may be localized, there's a reason that the technician is standing behind a lead wall and they have a lead draped apron on, and they have their genitals covered and maybe even headgear. It's because it doesn't just go into that one spot. So I know a lot of people think that, and that's a common question. It's like, I had breast cancer, but my feet are affected. Why is that? It's because it affects the whole body. And the vessels in your hands and your feet are just more susceptible to these issues because they're smaller, they don't have as much protection, and that's why they get damaged. So cancer, it can be a sign, especially if you have a lymphoma. Obviously, you're going to have swelling of tumors in those tissues, which will choke them off and cause those issues. So cancer is a big one. Then radiation treatments, like I've just talked about, they will damage the lymph tissue, and they will cause these glands to swell, and you'll have the fluid retention. And so I wanted to read this. So it affects 140 million people worldwide, and 3 million patients suffer from this disease in the United States alone. And it says here that patients with breast cancer-related lymphedema, which affects over 400,000 patients in the United States, studies have shown that the following treatment for breast cancer, patients have a 5 to 50% chance of developing lymphedema. this is probably dependent upon your comorbidities on how high that risk factor is. So obviously if you have disease, diabetes, if you have congenital, or if you have congestive heart failure or something like that, it's going to put you at a higher risk for developing these issues. And then obviously, you know, the more inflammation you have in your body is going to cause that as well. So surgery, if you have those lymph nodes removed, then that can cause the lymphedema as well, because now you don't have any way to drain off that area. And then parasites. So this is more common in third world countries. In my personal opinion, I think that we actually have more parasites here in the US than is really recognized, because so many people have pets. The food sanitation may not be as good as you really think that it is. A lot of people that I have met and talked to actually have more signs of parasites. I do have a video in this. You can go check it out if you want to learn more about parasites and do you potentially have them, and causes and treatments as well. I just don't want this video to be about that. Typically with parasites, you're looking at itchy anus, you're looking at skin rashes, a lot of digestive issues and gut issues. It can be signs that they have them, dark circles around the eyes. Not saying that those are only subjected to parasites, but it is a very common sign. So there are two types of lymphedema. There's primary, which is inherited. This is very rare. You probably don't have this type. And then the majority here have trauma to the lymphatic system, which can come from cancer, radiation, surgery, parasites. There can be other things that I've seen. Car accidents can cause it. Like I said, the congestive heart failure, I see it with a lot of my patients, diabetes. So I think this is just the major causes. I don't think that if you have lymphedema and you haven't had one of these, that there can't be another cause. You just may have to dive a little bit deeper into your health history. So how they diagnose this is, and this is a mouthful, so I'm probably not going to say it right because I'm from Tennessee, but it's called lymphoscintigraphy. And this is a nuclear scan where they're looking for damage to the lymph vessels. And this is something that your doctor can order. Most of the time they don't order it because the signs and symptoms are just there. They see that your legs are swollen. If they're starting to, have fluid come out of them, that is a very bad sign. You definitely want to try to get that taken care of. I have seen people's legs swell up so much that they bust open and they look like a watermelon, and then your chance for infection goes up. So this is why I'm making this video, so that you can address this before it becomes a bigger issue. And then there are 4 stages to this. Just almost every medical issue or these chronic conditions have 4 stages to them. So if the earlier you catch it, the better off you're going to be. This looks like with neuropathy, cancer, a lot of these different diseases that really cause a lot of issues. So stage 0 is when the lymph is not moving well. You may have like a little small area that's a little bit more puffy. And don't take this, and if you sprain your ankle and you have swelling and you're like, I've got lymphedema. No, it's like you've got a sprained ankle. Do you have like an acute lymphedema, right? This is more for people who, like I said, have these comorbidities that we're really trying to talk about here. So you may start having some swelling in the area without any trauma associated. And then stage 1 is the area is swollen and you get pitting. Edema, which is when you push your thumb. I usually go on either the medial or lateral malleolus, just depending, and push in. And if there's a divot in that area, then you have pitting edema. And if it doesn't relieve, if it stays there for a while, that's a big issue, and it's definitely something you want to talk to your doctor about. This can be relieved with legs up, or the affected extremity put up in an elevated position to help with that lymph drainage. The second stage is the swollen area is very firm. It's almost like hard as a rock. I know one patient, we do a lot of vibration with him, which is a treatment that I recommend, to just kind of shake and get all of that moving in there, and it does seem to relieve it. But sometimes his legs are so hard when we vibrate them, they just don't move at all. So that's a good little tip there, is use vibration therapy to get that lymph moving. And then they don't really get any relief with elevation at all. So even putting their legs or their extremities up, they still have the swelling. It never really goes down. And then the third stage is swollen, thick, and hard. So that looks like no relief. They can start busting open like I talked to you about earlier. And that is just where we don't want to be. We don't want you to get to that point where it is busting open. It increases your risk for infection. It's just not a good time for anybody. So some of the conventional treatments for lymphedema, which you're probably aware of, are just like compression socks, some exercises. Aqua therapy is going to be better because it's going to put less stress on your body, because these extremities can get very heavy. They can hold many pounds of water in them depending on how bad it is, which can make it hard to exercise. Bandages, compression devices, weight loss is a big one. So trying to get any excess weight that you have on you off. Laser therapy, we use low-level light therapy here in the office. This helps with angiogenesis. It helps with to repair those damaged vessels. You can use some forms of red light therapy, I think can help. I tend to go towards the infrared therapies because they specifically address the regeneration of the vessels in the legs. We use that for a lot of our neuropathy patients when we're healing their microvasculature and the nerve itself. And then massage therapy, you can do surgery, I mean, if you really want to, but I'm not the biggest proponent of that if you can prevent it. And then let me see here. So optimal diet recommendations, just a rainbow color diet, just to eat a Mediterranean diet. Just look that up. That is going to be your easiest thing to do. Just avoid a lot of these processed foods. I know you all probably, if you're into your health, you probably heard that a lot. Just Mediterranean all the way, most likely. Unless you're a diabetic and you need to do weight loss, then I might suggest keto. And then if you're not either one of those things and you have some severe autoimmune issues, carnivore is what I like to do, is how I coach my patients. But we don't do that forever. We only do that for a limited amount of time. Some foods that you want to eat in limited quantities include dairy, eggs, poultry, meat, oils, and condiments, dried fruit, sugar, and real maple syrup. Wine, specifically red, is only to be a drink on occasionally and no more than 3 servings a week. So sorry for all of my wine connoisseurs out there. Definitely control your blood sugars. I think that this is huge. I think that it's something that needs to be addressed, especially if you're a diabetic, because I see more diabetics with lymphedema than I don't. So control those blood sugars. You have to keep it in under 140. My standards are a lot tighter than probably your medical doctor. You got to keep that in under 140. Otherwise, you're going to be have an issue. And then watch your weight, obviously. Compression therapies. I like the compression socks. You just have to find some that are big enough sometimes. Massage therapy, hyperbaric can help. And then low light therapy. Those are the last ones that I have on there. And then there's an herb. It's called astragalus membranosus. And when it's administered orally, it has been put to clinical trials and it has shown positive results for lymphedema. So astragalus, I can put a link if anybody wants to, or if you, have one that you want to use. I think that that's great. If you want a good quality, I'll put one in the links below. And then bioflavonoids like quercetin and hesperidin have been shown to help stabilize capillary membranes, and selenium has also been shown to reduce the risk of developing lymphedema. Okay, so I don't want this video to go too long. Hopefully you got all the nuggets out of here that you needed. If you have any specific questions, please comment below. Check out some of my other videos, especially when it comes to your overall health, gut health. I'm a big proponent of. If you have neuropathy, reach out. We're able to help patients all at home with their neuropathy and with their lymphedema. So thank you so much for watching. See you all next time. Bye.